A very good afternoon, everyone. Today, I'm going to discuss about the self-reliance and success story of the Made in India plaque brachytherapy, which was initiated by the Baba Atomic Research Center and coordinated by our mentor, Dr. Santosh Ji Honnawar. We have no financial interest. The journey of plaque brachytherapy starts way back in the 1929 when it was first initiated by Foster Moore, and we have only evolutionized since then. Ruthenium, having a longer half-life, being a beta emitter, produces increased dose to the tumor with reduced dose delivery to the normal structures. However, the exorbitant prices, multiple import restrictions made the availability limited. It costs about 11 lakh rupees to procure one single plaque. Thus came a necessity to provide something which is available for a higher number of population, increasing the cost-benefit ratio. Let me take you through the story of BARC. It was generated, rather say, the best was generated from the nuclear waste, and thus introducing the Make in India BARC plaque, both round and notched plaques. Only 1 cubic millimeter of the nuclear waste can generate thousands of plaques, and this, when surgically implanted at oncology centers, was assessed, and the safety and efficacy is what we aim to assess to see how indigenous these treatments were. It was a retrospective study, non-comparative interventional case series conducted from September 2020 to October 2023, where we checked the clinical and radiological assessment, the tumor dimensions were assessed, documented, and brachytherapy was planned. The dose, the size of the plaque, and the dosimetry values to the apex and the duration was calculated and surgically implanted. The patients underwent a regular follow-up. We totally studied 101 patients, where 70 received primary treatment and 31 secondary treatment. Both round and notch plaques was used, and a mean duration of 32 hours was given. The results was varied, with 25 patients of OSSN, 24 of choroidal melanoma, 21 of hemangioma, and 12 retinoblastoma cases. We provided an excellent vision salvage of more than 80% in choroidal hemangioma, retinoblastoma, and OSSN, with close to 60% of patients receiving excellent vision salvage. These are some outcomes in invasive ocular surface neoplasia, conjunctival melanoma, choroidal amelanotic melanoma, hemangioma, and retinoblastoma cases. An excellent tumor regression was seen in 90% of uveal melanomas and 100% regression in metastasis and OSS in patients. This was also comparable to the COMB study, ensuring 100% globe salvage with more than 50% vision salvage, making it a safe and dependable treatment. We abided by the guidelines to ensure a protocol-based treatment. Multiple studies have been performed, and the effectiveness of ruthenium plaque is comparable. However, what about the cost? What about its availability to multiple population? Is it only restricted to few? And thus, our study is one of the first to check the cost of it with a high number of cases, showing that we can be both safe and efficacious with providing 62% of vision salvage, 98% of eye salvage, and 100% of life salvage. This is one of the largest studies showing effective, self-reliant, and successful solution, ensuring both globe and vision salvage. Thus, there is increased availability and accessibility at only 5% of the cost. Indigenous Made in India plaque brachytherapy has excellent outcomes, a cost-effective treatment useful for managing both intraocular and surface intraocular tumors, thus truly proving that the best can be made out of waste. Thank you.
Thank you. It may be prudent to highlight if there are any weaknesses in the study. I noticed your mean follow-up period is 22 months, and the largest group of tumors treated is uveal melanoma. When we talk about 100% life salvage, we need to be careful in talking about it, because the mean duration for recurrence of uveal melanomas after treatment is around 30 months, which is less than the follow-up period of your study. So maybe a longer study and then a longer period, and then you could present the study.
Okay, sir. Thank you, sir.